Welcome back to Bloom. Everyone is unique, especially in their response to COVID-19. And early treatment with COVID is critical, whether vaccinated or not. Joining us to discuss treating COVID long hauler syndrome are Dr. Garner and Dr. Teekell-Taylor. Welcome back to Bloom, doctors.
Thank you.
Thank you, Gayle.
So how do you define long hauler syndrome? I mean, you hear that tossed about a lot. How would you describe it?
Long hauler is anyone who does not recover weeks, sometimes months, and even now, even past a year. And the hard part about long haulers is they flip-flop. Their symptoms will go from one degree to the next, from one day to the next.
So what are some of the symptoms that you look for?
Gayle, this is the hard part. There can be many different kind of symptoms. We've seen rheumatological symptoms, joint pains, body aches, very many with neurological issues, brain fog, some very severe neurological issues, headaches that are really quite profound. The fatigue can be debilitating. There's a good deal of chest pain, sort of atypical chest pain that doesn't really follow a pattern, sensation of shortness of breath, extreme exercise intolerance, and people can even lose their sense of taste or smell long after they've had COVID.
And I know both of you specialize in tailored treatments for each individual patient, but how do you treat long haulers?
Well, we look at it from really three approaches, and so far this is working. We work to stabilize mast cells, we work to lower vascular inflammation, and then finally repair the immune system. Some patients will respond with one phase of that, some need all three phases. It just depends.
Now, is there a way to test somebody to find out if they're a long hauler?
Yes, Gayle, we use quite a bit of the conventional laboratories like Quest and LabCorp, but we've also partnered with an independent lab called Innovative Bioanalysis because they have designed a so-called COVID long hauler index, which is very useful in helping us guide treatment.
All right, and let's talk a little bit more about your practice. I mean, what I love about Docs Outside of the Box is you're not just a number. When a patient comes through the door, you're getting to know each individual, you're testing them, fine-tuning. Talk to me a little bit about how the practice works.
Well, everyone comes in as an establishing a patient unless they've come through urgent care. And in that establishing appointment, we help them figure out which direction in the practice they need to go. Some people just need typical care, but some people need intensive care, and the providers will help them figure that out. And we've also hired a new provider who will focus on COVID and everything COVID, and that is all she's going to do. So we're excited for that in the next months ahead.
And just quickly, how does the landscape look now? I know you guys were really busy when things were peaking here in the Tampa Bay area. What does it look like now?
Well, Gayle, right now we are recovering from the Delta. We're still seeing patients with the Delta variant. We are still dealing with COVID long haulers from 2020.
Wow.
And we are beginning to see a big wave of long haulers from this last variant. As far as variants coming in the future, we don't know, but we're on the ready.
All right, well, I know people are very appreciative that doctors like yourself are there to treat these long haulers. It's not easy, but you guys are the experts. Thank you so much for joining us on Bloom today.
Thank you.
Thank you, Gayle.
And you can check out Docs Outside the Box and Kids Outside the Box, located at 8950 9th Street North in St. Petersburg. You can always give them a call, area code 727-498-8898 is the number to call, or visit online, docsoutsidethebox.us. We will be back with more Bloom right after this. Stick around.
The preceding portion of Bloom was sponsored by Docs Outside the Box and Kids Outside the Box.